have to turn these away, can you? Can we?
Entrance to the Rook coronavirus drive-thru is via Admiral Rook Road by the Parcel Post Office, but you can't just drop in. The GHA website will give you a list of symptoms which include a cough, fever or difficulty breathing. If you have any of these, you should dial 111 first. The COVID GHA team will then decide if you need to be tested. If you do, you'll be given an appointment for the drive-thru, but you'll need to take your GHA card with you for identification. Once the formalities are complete, you'll be swabbed.
What I'm going to do, you're going to have a swab done today. What I'd ask you to do is, just hold that for me. Thank you. Just open your mouth, stick your tongue out, okay? And I'm going to go right to the back of your throat, okay? If I make you gag, I am terribly sorry. You okay? That's it. Thank you very much. Right. Okay?
Yes.
As the Director of Public Health has said already in an interview, we will never have enough swabs. I don't think any country in the world will have enough swabs, but I'm very satisfied that we're getting a constant supply of swabs and that will put us in a very good position to be able to carry out the tests that we need to.
Once in-house testing facilities are complete, we can expect a quick turnaround for results.
We're working around 24 hours at the moment, but we are almost ready to set up the equipment, so it's a question of waiting. We've said latest the end of the month, so and we're hoping that it'll be much sooner than that.
GHA staff will wear protective gear, but is this enough to allay concerns, given that we've seen a number of doctors in Italy and China who've been infected with the virus?
For us, it's important that GHA staff is fully protected, because without GHA staff, we won't be able to run all the tests that we need to carry out and to treat the patients and keep Gibraltar safe. We're very satisfied, and we're taking advice from the professionals as to what we should do at every given step of the way. So in liaison with the Director of Public Health and with the different groups that we have within the GHA, and we're taking clinical decisions and deciding what level personal protective equipment should be at, whether they need to wear masks or other protective equipment. As you see in this situation, you've seen our staff fully protected in that respect, because it is an area of greater risk.
The GHA also announced that all appointments at the primary care centre with either a doctor, a nurse practitioner or dentist have been cancelled.
At the moment, it's crucial to understand that hospitals and primary care centres, regardless of COVID-19, are not safe places to go. So the advice we're trying to give is only come to see a doctor if you really need to. So what we're doing at the moment is to try to avoid people coming to see us. There is a system in place where people will call the helpline. They will then talk to a medical professional who will then discuss their symptoms, how they're feeling, and then the decision will be taken as to how to progress from then on. But what is very, very important, and as part of Gibraltar culture, we're used to going to see doctors. I think something which many people do as a matter of habits, and I think that is something which we need to look at now, and we need to look at in the future as well. When this is all over, we really need to see whether we can reduce that dependence that we seem to have on doctors, because, as I said earlier, hospitals and primary care centres are not safe places to go.
And one final question, would you care to address some criticism of you personally about where you have been during this whole crisis, what you've been doing?
Yeah, well, I've been working constantly, although there have been, something was a very malicious comment, in fact, from someone within Parliament who said that, assumed that I was in Tarifa, sunning, and it's something which obviously I won't go out, trying to defend myself. I know where I've been, everyone around me knows where I've been, and that for me suffices. So all I can say is that we're working together as a team. I've been there leading the GHA, I've been doing the things that need to be done to ensure that Gibraltar is ready, and that Gibraltar, can look at COVID-19 in the future and say we did everything we possibly could to make Gibraltar and the community safe. So that is really what is most important in my mind, and those criticisms, well, I'll just take them on the chin, as I'm used to taking things on the chin. That is what what I do.
The Rook coronavirus drive-thru will be open weekdays from 10 till 2 as from Monday, although the hours will be reviewed to meet demand.